Solar energy is increasingly becoming the best energy source option, especially in rural areas that are not connected to the electricity grid. This is because it is a renewable source of energy that uses the sun's energy to produce light and heat. Besides, it is an environment-friendly source of energy since it does not emit greenhouse gases into the atmosphere. Selected health centers located in hard-to-reach sub-counties in the 4 districts of Chikube, Chibale, Kasese and Chegegwa are now benefiting from solar energy, cutters of Environment Alert, a non-government organization dedicated to environment conservation. The solar energy is provided under the supporting health centers in hard-to-reach areas in Uganda that are faced with energy access limitations project to improve the provision of health services.
Solar system is installed and energy needs are met, especially in terms of lighting, in terms of maybe refrigeration for the vaccines, for the maternity ward that is going to be of major focus. Then women will be able to access this place. They'll know that they can reach out and health workers will be able to receive them even at night, because I mean those are eventualities. No one will know when labor will be coming to them for delivery. So they will be able to access. We believe that with this installation, the health workers will be able to charge their phones and be able to have batteries, so that eases communication.
The administration of the benefiting health facilities are optimistic that the provision of solar energy will ease the provision of services to the communities that they serve.
If we had enough lights, maybe the number of deliveries that we have could be more. So we have a challenge of light whereby sometimes midwives perform deliveries on torches, which isn't good, and it limits the service delivery. So I think by coming of environmental alert, services are going to be improved, because light is something, it is a vital resource that we need.
We have been using torches, which has made our work very hard and difficult, and putting these mothers and the other patients at risk of bigger complications, like you may not clearly observe or examine what exactly it is.
The midwives are appreciative of the solar project, saying it will ease their work, especially when it comes to delivering mothers at night.
We have a problem of light. We don't have light at night. We deliver mothers on our phones, using our phones, which is so dangerous. Even if a mother gets a tear, we have to share her using our rights for the phone.
The leadership of the benefiting districts have pledged to allocate budgets for the maintenance of the solar panels.
The district has already committed itself in the budget this current financial year and the next financial year that we are planning for. Already they have marked some budget that would cater for maintenance of such facilities. Because we know if there is no budget at the district level, the sub-county might not, or the health center itself might not have enough. So that commitment is there, and it was discussed, and money has already been put in the budget to ensure that the system is well maintained. And those who are able to maintain it are facilitated in terms of training, building their capacity to ensure that the system does not break down, and that will be a very big loss and service delivery will be affected.
Environment Alert is also supporting these health centers with infection prevention and control materials like jik, liquid soap, bar soap, masks and cleaning brushes. The village health teams are also trained and supplied with teaching materials that have information on household disease control, how to care for expectant mothers, feeding of young children, and general information on how an ideal homestead should be like.
When we raise awareness of these communities, as you've seen, it's been hard for you to come and reach the health centers. That means that communities themselves, it's hard to get information on availability of health services. But when they're informed on the dangers of COVID-19, for example, dangers of the recent outbreak, Ebola, they can protect themselves. You can see the IECs we have given them have some detailed information on how to protect themselves against those diseases.
The village health teams commend Environment Alert for facilitating them with teaching materials, adding that this aids their empowerment of communities with knowledge.
Ahabo kutuhereza nketo nkaba VHT kutuhereza ebintu nashi ebikwato ebiturabasa kuyika mu community tukegesa mabasheja n'abakazi nangwa n'abakazi abo binenda abakuza kuchebeza hirwariro amwe nabo bari kuza kuzara hirwariro. So ni nsime shitongo lecho ahabokoro mulimo muhango.
Ilipatisha ni kwa ajili ya kufundisha watu ndani ya community kuhusu usafi, hygiene, namna gani tunaweza kujichunga, namna gani tuepuke uchafu kwa ajili tusipate magonjwa ndani ya community.
Communities in Chikube and Chibale districts are facing a challenge of poor access roads. They are now calling on government to upgrade the access roads at least to first-class maram.
Now, for example, this Chakare sub-county is a new administrative unit, but it is operational. But of course, the government has not yet allocated road fund to our sub-county, so we don't have money to work upon the roads. Secondly, we are not able to fund our roads in as far as our budgeting is concerned.
However, Environment Alert has built their capacity to demand for better services from their leaders, and some roads have been paved. In a nutshell, the provision of solar energy to health facilities will greatly improve health service delivery in hard-to-reach areas in the selected districts.